So here you can see various scopes used in ENT. Starting from your right, that is bronchoscope, this is MLS scope, this is civil rejection metallic DL scope, direct laryngoscope, this is esophagoscope, and these are three different variety of forceps used in bronchoscopy and esophagoscopy. So these are the scopes most commonly asked under undergraduate practical examination. So here is the metallic civil ejection metallic bronchoscope, the handle, the light carrier, this is air vent channel, these are the vents at the lower end, they are 4 in number. See the markings are generally not in civil rejection type of scopes, but it is there in Nagus variety of scope. These are the markings which will guide you from the upper incisor teeth, the level of scope. This is light carrier, how we can remove it. This scope is distally illuminated scope. Distal illumination and proximal illumination scopes are available. We will discuss in next slides. So here we have esophagoscope. See the handle, this is the handle, this is the light carrier, this is suction channel, operating channel, and these are the markings. These markings will guide us from the upper incisor teeth, the level of esophagus in the esophagus. We are rotating the instrument. So here we can see the difference between the bronchoscope and esophagoscope. Here you can see the air vents. Over your right, air vents which are absent in the esophagus. This is direct laryngoscope, civil rejection, metallic direct laryngoscope. This is the grip. This is how we are going to insert it during surgery. Now see the grip, how we have to hold it. This is the whole length, this is handle, and this is light carrier. So this is a microlaryngeal surgery scope, MLS scope. They are black color coated, so prevent glaring of light. They are held with chest piece, so they are self-retaining. See the holes, 2 holes. These holes are for light carrier, small holes for light carrier. These are the various forceps used in esophagoscopy and bronchoscopy. The last one is the suction cannula. This is suction cannula. So here you can see the instrument of nasal surgeries and ear surgery, which are important from undergraduate practical point. From your left you have this Citley sponge biopsy forceps, Citley sponge. Then you have Killian's self-retaining nasal speculum, Thadicum nasal speculum, medium and large size St. Clair Thompson nasal speculum. This is gauze, mallet, hook, single and double, uncuffed PVC tracheostomy tube, cuffed PVC tracheostomy tube, metallic tracheostomy tube with its 3 parts, that is inner tube, outer tube, and the payload. This is again a hook, single hook, and this is trochostecal dilator. In the upper channel you have this trocar with cannula. The video is cut. Farabupace, periosteum elevator, mastoid retractor, self-retaining, and ear speculum. So here we will discuss the Freyr's mucoperiosteum elevator. This is Freyr's mucoperiosteum elevator. The importance of this instrument is when you hold it from center, at both the side it is 7.5 cm, so it won't go beyond the cribriform plate and damage it. We are rotating the instrument. So here we have ear speculum. Ear speculum are available of three variety: grubbers, Toynbee, and Tumakin. These are the half slotted and full slotted ear speculum. Toward your left, right now we are rotating is full slotted speculum. This is the full slot used for giving infiltration in the canal. This is half slotted. The next one is the modified Morrison's self-retaining mastoid retractor. Here it has a catch lock. This is the lock, and there are prongs which will act as a hemostatic part. So the next one is the Farabupace periosteum elevator. This is Farabupace periosteum elevator, having a thumb rest. This is the thumb rest. Now move toward the next one, that is the Tilly's trocar with cannula. It is used for antral puncture, maxillary antral puncture. The procedure is now outdated. So this is the punch used in endoscopic TCR surgery and also functional endoscopic sinus surgery to remove the bone chips. See the movement. Next is the Killian's self-retaining nasal speculum. When we lock this screw, it will retain its position. See, here it is opened up and screw is locked. So Killian's self-retaining nasal speculum. This is Thadicum nasal speculum used in routine OPD procedure. These are the St. Clair Thompson medium and large bladed, long, medium and large size nasal speculum. This is, see how we have to hold the nasal speculum with the index finger, middle finger and ring finger with thumb. Chisel, mastoid, for mastoid, used in past. Now we have micromotor drill. This is hammer. These are the blunt and sharp hook. The sharp one is used at the lower side of the incision in tracheostomy, and the blunt one is used at the upper incision mark to retract the tissue, which will prevent the injury to the thyroid. These are the double-ended hook used in retracting various flaps during surgery. This is uncuffed polyvinyl toluolide PVC tracheostomy tube. This is cuff one. See, this is the cuff one. This is the cuff. and this is the pilot. We have removed the pilot. Now come to the metallic tracheostomy tube. This is civil ejection metallic tracheostomy tube. This is pilot, and this is pilot, and this is inner tube. This is Trozius tracheal dilator. This is the instrument which open up on closing. There are various instruments which open up on closing that which you will find in my lecture notes. Now see the tracheostomy tube, civil ejection metallic tracheostomy tube, how we have inserted the pilot. This is the pilot. We are removing it. Now see how the inner tube is placed. Pilot is used in initial insertion, then we have to put the inner tube. This is the lock. Now it has been locked. You can see the lock. This is how we have opened up the lock. We are removing the tube. The inner tube is usually larger than the outer tube. You will see it in a while. See, here you can find that the inner tube remains outside the outer tube, so it will catch the debris.